Chris Lounsbury, the Director of the Office of Emergency Management for the City and County of Missoula.
Yeah, and I think you're probably the only person that I personally haven't talked to about all that's going on in Missoula regarding Ebola. And so, first of all, I appreciate your taking the time to visit with me. Now, I understand that there is a lot going on in Missoula right now, being one of the only hospitals in the country that actually has some beds that are available for Ebola patients. So, how has that affected your office, and what do you folks there at the Office of Emergency Management have to do with that?
Sure. So our main role, of course, is that coordination piece. And so what we're doing is we're working with our partner agencies here at the hospital, talking with our fire departments, law enforcement, our ambulance companies, and just working to make sure that they have any information or any supplies that they need should there come a time when we end up with a patient here who comes into Missoula who has Ebola. We're also working really closely with our 911 center now to implement some nationally approved screening criteria that we could use should at some point there be a case that's reported in through the 911 system as well.
Now, Chris, do you happen to know what the procedure is? Because, you know, this is a very emotional issue, and people are they're calling the hospitals left and right, leaving messages, hoping someone will call. And, of course, they're absolutely deluged just trying to take care of their basic services of just running a hospital. So how would the public know, basically, since you're kind of the guy at the top of the disaster chart there, how would the public know if there was an Ebola patient, either at St. Pat's or community or coming into Missoula, aside from the ever-present social media?
You know, and there really isn't a direct mechanism to do that, of course. You know, there are several laws, HIPAA and several others, that prevent the hospitals from sharing information about patients that they have inside their facilities. So it's a good question that you're asking. My belief is that knowledge will be out there in the public because of those things like social media. You know, of course, our health department has been working very closely. They're the department that would be the lead agency in the county working on that. They're the ones who monitor things like infectious disease, and they've already begun to put out information just so that if a patient does come to the Missoula area, folks can do that. The City County Health Department's webpage right now has up a list of frequently asked questions for folks about the Ebola disease and Missoula's planning and those kinds of things right now as well.
All right. So as far as your office goes, are there any steps yet that you are still working on to try to to button this up, if you will, so that if it does happen, you're ready?
You know, I think the biggest thing is just, you know, for folks to know that the good part about having a premier hospital like St. Pat's here that happens to have these rooms is the fact that they actually work and train and drill these kinds of activities routinely. And so while it's put out there, and it's true that any hospital really can deal with a patient who has a highly infectious disease, be it Ebola or some other disease, we're fortunate to have places like St. Pat's around the country who do actually drill on that day in and day out so that they're well prepared for that. They also, the thing is, this is part of our normal process that we plan for. You know, Ebola certainly carries a large fear component with it, but we deal with things like H1N1 a few years ago, which have that same kind of potential fear with it for folks. And the best cure for that we have out there is just trying to get the best information out in front of folks. And so our office, the health department, other public agencies, our ambulance services, our hospitals are all working to make sure that their staff is prepared as possible, and also that the best information is out there for the public to help kind of allay as many of those fears as we can.